For example, lymphoma. We have a lot of patients that have been on healthy diets, but their lymphoma tumors continue to grow. You put them on a fast, you see a rapid change. You go from stage 3 lymphoma in 21 days of fasting to not having palpable tumors. Now, the other side is some people are addicted to the artificial stimulation of dopamine in their diets, and they can't get off the sugar, oil, and salt. And so if you put them on a fast and reboot them, now they are able to make that transition.
Well, hey, y'all. Welcome to the Switch for Good podcast again. So glad you've joined us. It's Alexandra and Dotsie together again. And this is not just another Wednesday. We are so intrigued by our guest today because literally every day, more evidence seems to be uncovered about the potential of fasting to transform health and well-being. From treating autoimmune disorders and reducing blood pressure to aiding in addiction treatment, the support for this practice continues to grow. And today, we are joined by a leading advocate of medically supervised water-only fasting. As the founder of True North Health Center, Dr. Alan Goldhamer has guided literally thousands of patients, I know a few of them, through this process. His work has profoundly influenced the field of integrative medicine, and he has dedicated his entire career to promoting natural, non-invasive methods for achieving optimal wellness. He is also the co-author of the book, The Pleasure Trap, which offers solutions for overcoming self-destructive habits and making positive lifestyle choices. And his latest book that's came out today when we recorded this, which was just last week, Can Fasting Save Your Life?, which is co-authored by Toshia Myers, explores the science and the benefits of fasting. Dr. Goldhamer is also a strong proponent of, you guessed it, a whole food, plant-based diet, and has been featured in documentaries like Fasting and also What the Health. So stay with us because we are going to delve into his insights on fasting and discuss the vital role of a whole food, plant-based diet in disease prevention, of course, exploring key strategies to restore our bodies back to an ideal state. So thanks for joining us. We know you're busy, Dr. Goldhamer.
Glad to be here.
Great. All right. I'm just going to start from my heart. Fasting is an intriguing subject to me, as Alexandra knows. As a former anorexic who almost lost her life to the disease, I have trouble wrapping my head around why I would stop eating again for any extended period of time. I worked my butt off to heal and enjoy life post-recovery, and I am completely and totally recovered. I eat what I want, when I want, how much I want, and there's no world any longer for me where food and thoughts of food rule my day. So talk to me why you believe so deeply in fasting for optimum human health.
So, today it's pretty obvious if you look around, we have some pretty serious health problems. 72% of the population are overweight or obese. And although people would like to think of, say, overweight as just an aesthetic challenge or something, the fact is it's a very major risk factor for the common diseases that are killing everybody you know. Heart disease, cancer, diabetes, autoimmune diseases all have dietary excess as a root contributing cause. And what's interesting about those diseases, even though they're the leading cause of death and disability, they're treated as if they're completely independent entities. You have to actually go to different types of doctors even to be able to evaluate these supposedly unrelated conditions. Yet in reality, all of them have one thing in common. They're associated with inflammation, and that inflammation can be massively contributed to by not just fat, but particularly a type of fat called visceral fat. So somewhere around 10% of fat is often visceral fat, a type of tissue that accumulates around the abdomen and in the organs. And that visceral fat gives off inflammatory products that are the contributing causes of these chronic degenerative diseases. So essentially, if you say are 20 pounds overweight, you likely have a couple pounds of visceral fat. It's essentially like having a 2-pound abdominal tumor. If you went up to somebody and said, look, you have a 2-pound tumor in your abdomen, they wouldn't be shocked to find out that that's probably not helping their overall health. And in fact, that's exactly what's going on. So we have these large amounts of hypertrophic, hypermetabolic tissue producing inflammatory products because we got overweight. And we got overweight because we ate a diet that fools the satiety mechanisms in our brain. So we ate foods that had certain chemicals in them, and those chemicals allowed us to have to eat more before we reach normal satiety. And that's why people are fat, sick, and miserable. And the chemicals that we're putting in the feed that cause us to be overweight are salt, oil, and sugar. Salt, oil, and sugar aren't food. They're hyperconcentrated food byproducts we add back to food to stimulate dopamine in our brain so it tastes better. That's what tasting better actually means, is that whatever you're eating, it results in more dopamine stimulation in your brain. It tastes better because that's what it is, more dopamine stimulation. And those chemicals, the salt, oil, and sugar, do a better job of stimulating dopamine than whole foods themselves. So if you just eat a whole food diet, it becomes very difficult to achieve and maintain obesity because you eat a certain amount and you feel full. But when you salt the food, you add sugar and oil to the food, it's impossible not to overeat the food if you eat to satiation. So essentially, we talked about that in our first book, The Pleasure Trap, that people get fooled by the pleasure induced by these neurochemical changes into engaging behaviors that are not helpful. Some examples of the pleasure trap are drug addiction, whether it's alcohol or cocaine or methamphetamines or caffeine or nicotine. But another cause of the pleasure trap or the dietary pleasure trap is eating foods that have salt, oil, and sugar added to them. So now you have a population that's overweight. They're producing inflammatory products. They're developing diseases. I might mention those diseases used to be pretty rare. They were called the diseases of kings because it was only the wealthy elite kings that could eat the diets that led to the obesity. They were the ones that got the gout and the heart disease, et cetera. And so now they've become, very common. In fact, the leading contributing cause of death and disability. So once you get that, it makes more sense why we would consider something like fasting. Because it turns out that fasting is a way of helping undo the consequence of dietary excess. So when a person goes on a fast, their body adapts to fasting. The brain, which is your main burner of glucose, changes to burning fat instead of sugar. And so if you look at what happens to body composition in fasting, which is what we've done in a recent study, using a DEXA scanner to evaluate body composition changes in fasting, you find that people lose weight. Some of that weight is fat, some of that weight's protein, some of it's water, some of it's fiber, some of it's glycogen. And then if you look after the fast, people regain weight. But what's interesting is the weight they gain after fasting, assuming they're eating properly, is water, fiber, glycogen, and protein, not fat. The fat continues to come off, and particularly and preferentially the visceral fat. So, for example, a typical person that fasts for, say, 2 weeks would lose 10% of their total body weight, 20% of all of their fat, but maybe 40% of their visceral fat. And then when they go back to eating a healthy diet, they regain water, fiber, glycogen, and protein. In fact, the lean mass at 6 weeks after fasting is actually higher proportionally than it was at baseline. All that's happened is they've transformed their body composition and dramatically eliminated fat and preferentially visceral fat. Now, granted, you still have to do the dangerous and radical things like eat well and exercise and go to bed on time in order to sustain the results. But it's a very fast track of making that transition.
Dotsie began this with asking about fasting for health. And I understand from you now that one of the very important aspects of fasting is to lower body fat, which lowers inflammation. And that has so many health benefits. Is the same mechanism applied to trying to get rid of cancer tumors or high blood pressure or other diseases that you treat? And I just want to say in the beginning, folks, that this is that Dr. Goldhamer's patients are under his supervision. And so none of this should be done at home, just for, your own experimentation, because what Dr. Goldhamer is doing with his very sick patients is long-term fasting protocols, and those can be dangerous if not done under supervision.
So we're fasting patients from 5 to 40 days on water only. But every patient that fasts, first of all, you do want to review the medical history, make sure they're a good candidate for fasting. You need a physical exam and some baseline laboratory testing so you'd be able to determine, again, are you a good candidate, and have some reference point to be able to tell if the symptoms that come up in fasting are good things or bad things. It's important that people rest when they're fast. If they're too active, they'll lose more weight, but it won't be fat. It'll be lean tissue. And they need to recover carefully after fasting, particularly prolonged fasting, or it can be dangerous or fatal. You can get refeeding syndrome, post-fasting edema. There's lots of problems that happen if you take a person that's done a long fast and too rapidly re-aliment them. So you want to make sure that the protocols are followed. That's one of the reasons why we wrote this book, is so that people would have all the information they need in conjunction with their local physician if they want to fast at home, or coming to a place like True North Health Center if they're going to fast in a controlled setting. We do offer some support through our telemedicine practice. If a person wants to do a fast not at True North Health, they want to do it at home, they can do that safely if they work with their local doctor and they work with one of our remote coaches. We can certainly help them figure out what to do and how to do it. And the book provides all the information the patient and their doctor needs to know to understand what testing needs to be done, how to monitor that, what the significance of the changes that occur in fasting are. So fasting is a biological adaptation. All the human beings that couldn't fast, that couldn't change their brain from burning sugar to burning fat, they all died. And we know that because all humans today, if you take calories away, within 48 hours, they've depleted their glycogen stores. Their brain changes over from burning sugar to burning fat. This is a biological adaptation. The reason why all the humans died that couldn't do that was because sometimes spring comes late. And human beings have massive brains that are our biggest burner of glucose. So if you have a human brain, you can only go about a week or so before you'd enter starvation and die. But if a human being could change its fuel from burning sugar to burning fat, they can go 10 times that length, 70 days or longer. Not that you should. I'm not suggesting people fast for 70 days, but you could, because you're able to conserve your resources in a way that you wouldn't be able to do if your brain kept burning glucose. For example, chimpanzees aren't able to make that conversion. You'll never see chimpanzees wandering away from the tropics, will you? If they don't have a continual source of readily available food, they get into trouble pretty quickly. Human beings did wander away from the tropics, and that was one of the reasons we were able to do it.
So what is the mechanism, though, just to follow up, that makes it so that fasting lowers inflammation because you lose weight, and then it also can help with cancer, something very different from...
Just like when we look at visceral fat as being kind of tumorous, you don't just, if you lose 10% of your body weight, you don't lose 10% of your visceral fat. You lose disproportionately more visceral fat. Why? Because the body breaks things down in inverse proportion to its needs. So if you go on a fast and lose 10% of your weight, you may not lose 10% of your lymphoma tumor. You may lose 50 or 100% of your tumor, as we've demonstrated in reports we've published, including in British Medical Journal case reports. So the body's ability to break down some tissues versus other tissues is an important part of the adaptation to fasting. And so some tissues, like nervous tissue, is preserved, and fat and visceral fat, particularly growths and other problems, are preferentially mobilized. And so that's one of the tricks we're able to use, is you put a person on a fast and get the body to, it's like if you think about a computer, you know, sometimes you're using your computer, it becomes corrupted and you don't know, it doesn't work. You shut it down, you turn it back on, and now all of a sudden you don't know why, but things are working again. Well, essentially, that's what we're doing with the human being when we fast them. For one thing that reboots is the gut microbiome. You know, you have 5 pounds of creatures living in your intestinal tract. We're talking 1 trillion creatures, bacteria, protozoa, et cetera. And in a healthy person that's on a whole plant food diet, they have maybe 1,000 different strains of organisms working together to protect you immunologically, to produce essential nutrients. If a person, say, for example, is on a greasy, fatty, slimy, dead, decaying flesh diet, where they're dominated by meat and fish and fowl, eggs and dairy products, they have completely different organisms and completely different poo from those organisms. Because you think those creatures are swimming around eating, drinking, and defecating inside you right now. And what they poo in you depends on what you feed them. And so if you feed them plant-based foods, you're going to get fertilizer like vitamin K and things you need. You feed them the dead Dr. Atkins diet, Ms. Flav, soul rest in peace, you're going to get the kind of bacteria and the kind of waste products like TMA, which is trimethylamine oxidase, which causes associated with heart disease and cancer and problems. So this microorganisms that live in the gut are profoundly affected by fasting. So you get a big die-off, and then if you put the right prebiotic formula in, that is diet, vegetable cellulose rich plant-based diet, you grow normal organisms back, which is probably why we see such good clinical results in bowel-related conditions like ulcerative colitis and Crohn's disease, but also why it may be affecting seemingly unrelated conditions like depression and anxiety, where, you know, a major part of the neurochemicals that are associated with dopamine, serotonin, whatnot, are produced actually in the intestinal tract. We also see profound effects on conditions like high blood pressure. High blood pressure is one of the leading contributing causes of death and disability. And we did a study that's described in our book. 174 consecutive patients with hypertension, 174 people normalized pressure without the need for medication. We have the largest effect size that's ever been shown, with an average drop of 60 points in stage 3 hypertension. Essentially, all the essential hypertensive patients that fast will eventually normalize their blood pressure. And if they're willing to do the whole plant food diet, they can maintain it.
How long did they need to fast, for example?
These fasts will range from 5 to 40 days. It depends on how much visceral fat they have. It depends on how high their blood pressure is. It depends on what other concomitant diseases they have. But the fasting ranges from 5 to 40 days, but the typical fast is 2 to 3 weeks. So the typical person coming in, they're 160 over 100. They're on a couple of blood pressure medications. These people will have normal blood pressure without medications by the time we're done with them. And yet medically, that's not true. Medically, the doctors will tell them, listen, you'll be on these drugs the rest of your life. We promise you, if you do exactly what you say, you'll never get well. You'll be sick forever. And because there is no getting better from high blood pressure, diabetics are told the same thing. You'll be on drugs the rest of your life. Autoimmune diseases, you'll be taking these drugs the rest of your life. Cancer patients, we're going to do all this therapy, but you're never getting well. So, I mean, the reason is because they're not dealing with the reason why people are sick, which is the dietary excess that leads to the fat, that leads to the visceral fat that produces the inflammation that causes them to be ill. This is a different approach. It's resolve the inflammatory products with fasting, do the diet and lifestyle changes so you can maintain the results. And people that are willing to do that, as we've demonstrated in over 20 papers now published in peer-reviewed journals, you can not only do it while you're fasting, but you can sustain that. People are capable of making these diet and lifestyle changes.
I feel like it's fairly easy to see how starving a tumor would shrink it or get rid of it during a fast. But I'm interested in both the metabolic changes and advantages that happen when someone comes in, like you're describing right now, high blood pressure, hypertension, maybe they have or have not had cancer, severely overweight, on a lot of medications. So they're most likely coming from a SAD diet. So that diet to water fasting to a whole food plant-based, because obviously if they go back to the SAD diet, they're going to be in the same situation at some point after the water fast. So that process, SAD diet to water fasting to whole foods, versus or compared to just from a SAD diet to a whole food plant-based diet, is it just the speed?
Well, I'll give you an example. We had our most recent case report that we're publishing was a very famous vegetarian for 15 years who had been on a vegetarian diet strictly, but maybe a little bit of flexibility around the salt and some of this type of stuff. So he developed some elevated blood pressure, and he had a massively elevated what's called lipoprotein(a) measurement, which is thought to be a genetic marker for heart disease. And like, for example, Medicare only pay for one test because it's not considered changeable. It's supposed to be genetic. And so you do one, you're at risk, you're supposed to, go on a healthier diet. But what we did at him is we carefully measured his lipoprotein(a), we measured his blood pressure, weight, et cetera. We put him on a 10-day water fast. Not only did his blood pressure normalize and his weight improve, but his lipoprotein(a) dropped by 40%. And so, we're able to demonstrate that this supposedly genetically unchangeable marker, in fact, may be changeable. And certainly 10 days of fasting was enough to do it. So here's a guy who was already vegetarian, and compared to everybody else was pretty healthy. But, that's an individual that still can get profound benefit. In fact, we did a study on healthy.
But that doesn't help the question, because what would have happened if he just dropped dairy?
Well, he wasn't on any dairy. He was on a vegan diet, but he was eating a little bit.
You said he was totally vegetarian.
Yeah, he was on a vegan diet. So no meat, fish, fowl, eggs, or dairy products, but was using a little bit of salt and sugar in the diet. So as you know,
so he's all
most
vegan.
vegetarians are not health conscious. Most vegetarians are morally, ethically, and spiritually driven. They want to save the animals. They don't want to see animals tortured. They want to save the planet because they recognize that animal husbandry practices are responsible for bigger impact than the internal combustion engine in terms of global warming and the rest. But their own personal health is pretty low down the list for most vegetarians. That's not what's driving most vegetarians primarily.
No, not at all. But I was curious from SAD diet to water fasting to whole foods as opposed to SAD diet to whole food plant-based diet? Like, what does the water fasting in between the SAD and the whole food plant-based, strict whole food plant-based, let's say, what does that do as opposed to just, changing your whole diet, which is hard, but they're going to have to do it anyway.
Most people, if they go on a whole plant food SOS-free diet, they will lose weight. Now, they'll lose a pound a day fasting, they'll lose 2 to 3 pounds a week feeding, but they'll eventually get there. So it's a little bit slower, but if you're persistent, you'll achieve your weight goal. Most of them will normalize their blood pressure. Most of them will normalize their arthritic pain. Most of them will get improvement. There are some conditions, though, despite being on a vegetarian and even a whole plant food diet, aren't responding adequately. And so that's where a lot of those patients are referred to us. Dr. McDougall was famous for telling people that we were the punishment. That if somebody went on the vegetarian diet and didn't get enough improvement, he would apologize to them and send them to us for fasting and a stricter regime. But again, most people will respond to diet and lifestyle change alone. Health results from healthful living. It's diet, sleep, exercise. But in some cases, people have trouble doing the diet, or they're doing the diet, it's not responding quickly enough, or they're on a medication profile that's hard for them to get off of. These are patients that will come to us for inpatient care, much more intensive intervention and control. For the vast majority of people, if they just do the whole plant food diet, they wouldn't get fat and sick and they wouldn't have to deal with these problems. And then fasting would only be used relatively short durations for preventative care. And as I said, we did do a study that showed that proportionally healthy people got more cardiometabolic improvement even than sick people. So if you take a healthy person on a whole plant food diet, but you introduce 16 hours of fasting every day or a week of fasting once a year, you'll see their numbers improve even additionally. So again, mostly it's diet and lifestyle. And without diet and lifestyle, no matter how much fasting you do, you're not getting where you want to go. You have to do the diet and lifestyle. Fasting may be a tool to help some people speed that process up or deal with a particular problem that may not be resolving with dietary change alone. For example, lymphoma. We have a lot of patients that have been on healthy diets, but their lymphoma tumors continue to grow. You put them on a fast, you see a rapid change. You go from stage 3 lymphoma in 21 days of fasting to not having palpable tumors. Now, the other side is some people are addicted to the artificial stimulation of dopamine in their diets, and they can't get off the sugar, oil, and salt. And so if you put them on a fast and reboot them, now they are able to make that transition. So it's very much like alcoholics. You can say, well, why don't you just quit drinking? Yeah, that works great. If you do it, you win. But some people have trouble doing it. And just like, alcohol, which is the same kind of pleasure trap thing, some people have trouble making the diet and lifestyle changes. And so they need
it's like a competitive
help.
advantage, the water fast in the middle, big time.
Can we define fasting, the different kinds of fasting? You mentioned yours is prolonged long-term water fasting. And then you mentioned the 16-hour intermittent fasting. And then there's the 5-2 diet. There's all sorts of different.
So there's all kinds of fasting. We talk a lot of all these in the book in detail, but the two that we use and we've used for 40 years is time-restricted feeding, which means we ask people not to eat 3 hours before they go to sleep at night. And that will give them somewhere between 12 and 16 hours of fasting every day, depending on what time they eat in the morning, if they exercise before if a person is trying to lose weight, some people find that a 16-hour fasting window, 8-hour feeding window is helpful to them at avoiding the late night eating, which oftentimes is not because they're hungry, it's because they're tired, angry, fatigued, irritable, whatever. And they're eating to feel better, but not necessarily meeting their nutritional needs. So we try to get rid of that. And if you're trying to lose weight and you get up in the morning and you do some exercise before you eat, it preferentially tends to mobilize fat. So it may be a useful fat way of losing additional fat a little faster. But basically the idea is don't eat for the 3 to 4 hours before you go to bed. And then when you are eating, stick to a strictly whole plant food SOS-free diet. If you do that and you're a male, you're going to lose about 3 pounds a week down to optimum weight. If you're a female, you're going to lose about 2. Women will lose about 50% less weight because they're biologically full of estrogen, which is a fat storage hormone, and they're designed to store more fat. Healthy women have a higher percent body fat than males because they have to survive a period of biological vulnerability called pregnancy, which no male has ever had to deal with. And so if you're a woman, it's going to be easier to get fat. It's going to be easier to store fat. It's going to be harder to lose fat, say everything else being equal compared to, say, a male. And so, what does that mean? If you're a woman, you have to work harder. It's just like everything else too. I mean, it's not just weight loss.
That's why we're the ones who have the pregnancies, because we can
Oh
deal.
yeah. If males had the babies, I did the math. Our species would have gone extinct, and I can prove it because you have to average 2.1 births per couple on average for a species to be sustained. And if males had the babies, I guarantee you there never would have been a single case of a second birth, not even one time, which means in 20 generations, the species would have been completely extinct.
I totally agree. I always say, when people say, get some balls, I'll say, no. It's not the testicles. Those things, you hit them and they're incredibly sensitive. It's get a uterus, folks.
No, tough. Absolutely. Well, I can tell you that from being in practice for 40 years. Yeah, you definitely, it's, there's no question. There's big differences, but one of those differences is it does make it harder in terms of control, particularly if people are on an SOS inclusive diet where they're eating salt, oil, and sugar. The only question is, how far can you go without having to get rid of the things causing it? Think about alcoholics. You don't tell alcoholics, well, just drink beer and wine, you'll be fine. You don't say, well, put your alcohol in a smaller cup and you won't be a drunk anymore. Or drink your alcohol with a spoon and put the spoon down between each slurp and you'll be fine. We tell alcoholics the truth. We say, oh, you're sensitive to those chemicals. You don't do well with that. You have to not drink at all. Not just on the weekend, not at all. And that's not considered radical or outrageous. That's considered the truth. But we tell overweight people, oh, well, just eat less. Yeah, that works well. Put your food on a smaller plate. Put your fork down between each bite, and you won't be overweight anymore. We lie to them. And as a consequence, I want you to think about the numbers. If you're an alcoholic, and you go to a 30-day inpatient program and spend $40,000 and go to 90 visits in 90 days, and you have family support, 83% of those people will be drinking within a year. So there's an 83% failure rate. If you're a heroin addict and you go to a court-mandated inpatient program and you have family support, 90% of addicts will be back using drugs within a year. If you ask a person to lose 5% of their body weight and keep it off for a year, there's a 95% failure rate. So you have a lower success if you're a physician advising a patient to lose weight than you do if they're a heroin addict or an alcoholic. And it's because I believe we lie to overweight people and they don't understand they have to go on a whole plant food SOS-free diet if they're going to have a consistent success long-term at sustaining weight loss. And, that's considered radical.
Yeah, for sure. I know. And so the water fasting coming from, let's say, a SAD diet, it's what helps them to sustain afterwards.
Exactly. The food tastes like disgusting, tasteless swill when people go from a SAD diet to eating a whole morning diet. They're addicted to the salt, the sugar. If you take that away, they can't even do it for a meal, let alone, but after fasting, good food tastes good. We actually did a study on taste adaptation. It shows your sensitivity to salt and sugar changes, hedonic response to food changes. So it makes it easier to get them to do the whole plant food diet. Where it seems impossible before, it seems more practical. So that's a useful tool of fasting, taste adaptation. It's useful to reboot the gut microbiome. It's useful to detoxify people. If you do a fat biopsy on a human being, particularly one that's eating animal foods, they have PCB, dioxin, pesticide residues, heavy metal. Their body is a toxic waste dump. In fact, some people say fasting is so efficient at getting those toxins mobilized and eliminated, you shouldn't ever do it because your body wouldn't know what it's doing. And unless you buy their proprietary products, then apparently it's okay. But the reality is fasting does mobilize those materials, and it can be very unpleasant. Your mouth will coat up and taste like something crawled in there and died. You can have skin rashes, detoxifying symptoms. But then once you drop the total body load, the effect those chemicals have also are reduced. And so that's another way fasting can be helpful. With hypertension, if you have people on hypertensive medications, some of the common side effects are chronic cough, fatigue, impotence, and even increased risk of death. Once you normalize their pressure, they don't have to have the negative effects from the medications. They're more able to make the diet and lifestyle changes. People with elevated lipid levels are taking statins. They don't even realize a lot of their joint pain and other problems they're having may be directly related to their statin medications. We find a lot of improvement. Just getting people off the drugs is enough to start getting people making significant improvements, and then they're more willing and able to make the diet and lifestyle changes. If you're already doing the diet and lifestyle changes, you're already getting healthy. So if you've achieved optimum weight, your values are normal, the blood pressure is fine, fasting becomes a preventative maintenance issue. We're not telling healthy people they have to fast 40 days. These longer fasts are for people that despite their best efforts or in spite of their best efforts, they haven't been able to achieve the level of health that they need to achieve.
Did you know that nearly $500 million is literally thrown in the trash every single year because of a corporate welfare scheme in the National School Lunch Program?
Wow, Dotsie. Well, what's all that taxpayer money wasted on?
You see, K through 12 schools are actually federally mandated to include a cow's milk in every single school lunch. And according to USDA data, about 1/3 of these cartons are thrown away untouched because the kids just don't want them. How's that for government waste?
That's hardly surprising considering 1/3 of Americans are lactose intolerant, just like me. Now, I know that the WIC program provides non-dairy choices for children under 5, but it seems like the NSLP revokes that parental choice once those children enter 1st grade.
Yes, that's absolutely true, Jason. Moreover, the dairy industry gets to double dip on corporate welfare, from government subsidies on the front end to guaranteed market in schools on the back end.
This government waste is just unacceptable. Well, what's the solution, Dotsie?
The bipartisan Ad-Soy Act introduces competition finally into the NSLP between dairy and non-dairy milks that are nutritionally equivalent for the kids.
So the Ad-Soy Act doesn't remove dairy milk. It just gives kids and parents the freedom to choose the right milk for them?
Exactly. See, with the Ad-Soy Act, we can empower students and parents and cut government waste at the same time.
Let's pass the
Ad-Soy Act and do right by our kids.
What is your fasting protocol, if any, for yourself who do eat a whole food, plant-based, no oil, no sugar diet? I listen to Chef AJ, who we've had on this show, and she talks always how you're very, very strict.
Well, it's easy for me. I work at the True North Health Center where we have an exclusively whole plant food SOS-free diet available. So I don't have to do a lot of work because it's sitting right there. I've done this since I was 16 years old. I've never smoked a cigarette, had a cup of coffee, taken a drink, done, because I got started really young. It's a lot easier to if you never knew it, you don't get addicted to things, you don't have to break the habits, because I never had it to begin with. And so I've eaten a whole plant food SOS-free diet. I do that, and it works great. I'm 65 now. It gets a lot easier. I've been doing it for since I was 16, so you figure that's a lot of years of practice. The truth is, for most people, once they make this transition, it's not a lot of discipline to maintain it, because you really lose your desire for the greasy, fatty, slimy, processed, dead, decaying flesh and how it makes you feel. You feel better not eating that. So you get reinforced every day. And, I see it. I play basketball. I play with, 20, 30, 40-year-olds, right? And they're already aging out. And so, I can see the difference functionally really apparent. And these are, comparatively healthy, fit people, but you can see especially as they get old, like in their 40s, they start having trouble and slowing down. And then when you get to people, like I'm seeing some patients now, 30, 40-year follow-up. So people that were in their 40s and 50s, now they're in their 80s or 90s. And what's interesting is their stories are almost always the same. They say, well, everybody they know is dead. And even sometimes their kids have died from heart attacks and cancer and whatnot. And so, like my mom, when she was 92, she had outlived all of her friends, all 52 of her lifelong friends. She said, Alan, you have to warn your patients, if they're going to do this kind of diet, make younger friends. Because it gets harder to make friends when you're 90, because she said even friends 10 years younger people 10 years younger were too old because they were sick and spent all their time with the pills and potions. And so I think you either make younger friends or find a few friends that are on a whole plant food diet. So there'll be people left in your later years when you want to still have fun.
Oh, phew, Dotsie, I have you. But Dr. Goldhamer, do you fast yourself?
I do. I hate fasting. I find it awful because you have to rest. You can't play basketball. You can't go to work.
Right.
And so I don't like it, but I do fast every year, like I suggest all my patients do. For a week, if everything is fine, you're done. I fast every day for between 12 and 16 hours, usually 16 hours. So that's my routine is every day fasting 12 to 16 hours once a week, 1 week fasting once a year, or however long it takes to resolve any issues. As I said, I got started so young, I really don't have any issues. Fasting is very easy for me because I don't get any symptoms, except that you have to slow down. And that's I don't like that.
It sounds like they should introduce water fasting into alcohol treatment centers.
Well, we treat a lot of patients successfully with addictions to the pleasure trap, including drugs and alcohol. And it is amazing. Like cigarette smokers, for example, by the second day of fasting, report no cravings.
Wow.
But now some people say, yeah, they're so miserable fasting, they don't think about the cigarettes. And there's probably some truth to that. But, the fact is it does help the processing more rapidly of these problems. I have to say, though, I think addiction to salt, oil, and sugar is a more prominent, more dominant problem right now, and it's not recognized. In fact, I probably get the most criticism recommending not just sugar restriction, which is starting to become accepted. And some people even will acknowledge the benefit of getting oil out of the diet, oil in the terms of processed oils, but they don't like the idea of reducing salt intake. And so, whether it's sugar or salt or cocaine, any of these white powders, I think you got to be careful about.
We've read The Pleasure Trap. Of course, we've discussed it on this show. If you could talk a little bit about the theory, you touched on it earlier, and the environment and how we are affected by our environment way back when to now.
Well, the world of our ancient ancestors was a very different environment than the world we live in today. There were no massive chemical concentrations, that people weren't able to afford to eat large quantities of animal products. Fresh air was the only kind of air that there really was. Sunshine exposure was necessary because there was no plate glass windows to filter the UVB. So, the world we lived in was one where the goal was get enough to eat and don't get eaten. And honestly, most human beings never lived long enough to reproduce. They're what we call the losers. But your ancestors were the ones that got enough to eat and didn't get eaten. So they managed to figure it out. And it was a relatively smaller percentage of the total population. Most people died from starvation, predation, and all kinds of other, challenges, because it was a very harsh environment that we lived in. It's only in the recent modern environment, really the last 200 years, that people have been able to get access to these highly processed foods since the Industrial Revolution. So, you had 100 or 200,000 years of modern humans living in a natural setting of scarcity, and you have 200 years of living in an environment of abundance. And that's essentially what's going on, is we've just fooled our brains because of the dietary pleasure trap. And now the majority of people are overweight or obese. In fact, only 12% of people are metabolically healthy right now, and only 2.7% of people actually maintain what would be considered a reasonably healthy diet, body weight less than 25% for a female or 20% for a male, don't smoke. Even the most basic and are moderately active. That's like 3 out of 100 people. The fact is, most people may not know anybody that's actually healthy.
Wow. And when you say metabolically healthy, can you define that for our
Essentially
audience?
being, if you're a female, having a percent body weight less than 25% and having normal blood pressure, blood sugar levels, the basic measurements of decent health.
What day, I'm imagine it's days, does fasting stop and starvation begin, that the body?
So fasting and starvation are separated by the fact that fasting means there's labile reserves available to burn. If you burn up those labile reserves, you will then begin breaking down your lean tissue. That's called starvation, and then you will die.
What are labile reserves?
Labile reserves are like your fat stores, the nutrients that you can mobilize without breaking down your lean tissue or your nervous tissue, et cetera, heart tissue. And so we are very careful to avoid starvation, because that would be really bad for our outcome data. And we've managed to do that 25,000 times in a row. We've had 25,000 people come in for fasting, 25,000 people walk out. So we have no mortality associated, even our long-term fasting, which is really quite remarkable when you realize how many sick people we really treat.
Yeah. Well, I didn't think you did have any people that starved to death, but I was curious, like metabolically and just the process of the human. So it sounds like the larger you are, the longer that would take until you got to starvation.
Because you have some people that are they're not big, but they're over fat. So they may not be overweight, but they're over fat. You have some people that are really high BMIs, but they're all muscle. And so they have low percent body fat. So the point is, again, even a skinny male could fast as long as 70 days if you wanted him to. So you've got way more capacity to fast than what we call upon in our controlled setting. So how do you know how long to fast? If you have high blood pressure, we want to fast you down to normal blood pressure so that when you refeed, you don't need to be on medications and deal with any of those issues. We did a study recently with our colleague from the Mayo Clinic on high blood pressure. We enrolled 29 people with hypertension. And during fasting, 28 people achieved normal blood pressure without medication, and one person required 50% dose of medication. And then we followed those people a year later to find out, could they maintain their blood pressure free of drugs, and could they maintain their weight loss? And it turned out that 75% of those follow-up people had maintained their weight and blood pressure. Not all of them had complied 100% with the diet, but they had done well enough with the diet that they had kept their weight down and they kept their blood pressure normal. 1/4 of them had some slip and slide issues where they had to go back on medications or they had trouble. So not everybody's compliant, not everybody is successful, but enough of the people are successful, a lot more than the 5% that would be predicted by the medical literature in terms of behavioral changes, and that's a year later. So highly motivated, self-selected people that are well-educated can make radical diet and lifestyle changes, and if they do, they win.
I'm sure that you are familiar with that study that was done 50, 60 years ago with young men in Michigan, I think it was. They were young men and they were put on a restricted diet and they lost a lot of weight. And after that, they struggled with dreaming about food, and their relationship with food became distorted. And when they started eating again, they had trouble. They often went back over and above their old weight. So there's that. We've been told that if you restrict too much, then your metabolism will slow, and when you start eating again, you'll put on weight.
So the facts are that metabolism does slow during fasting, but by the length of the fast refeeding, it's back to normal metabolic levels. So there's no persistent or permanent downturning of metabolic function. There is improved absorption and efficiency. So sometimes that's confused because it is easier probably to gain weight on crappy diets when you're healthy than when you're sick. If you get people sick enough, they can even eat a crappy diet and lose weight, but that's not necessarily health promoting. So the point is metabolic rate slows in fasting, it recovers in refeeding, but that's why we require half the length of the fast in a controlled setting. Because when you first come off a fast, your HOMO-IR, your insulin resistance is actually a problem because you're metabolically converting back to burning sugar instead of burning fat. So there's a switch, a metabolic switch that's taking place. But that's why if you control refeeding carefully during that half the length of feeding, you can avoid these problems. If you go from fasting to binging, yes, we absolutely agree that can create problems. It can, in the worst case, result in refeeding syndrome. And remember, most people that are using fasting are not doing it in a controlled way. They skip a few meals because they're trying to lose weight, and they binge eat, and people wonder why they're having problems. And also, it's important not to go back to eating sugar and things that will alter your insulin production and then lead to binging and cravings. You also need to remember that there are contraindications to fasting. Anorexia nervosa would be one of them. People that are in an active phase of binge eating disorder, may not want to use fasting because it can be a trigger. So you can trigger eating disorder and aberrant behavior with fasting unless you have the right patient in the right circumstance and do it properly. For those individuals, you just put them on a whole plant food SOS-free diet and you're more patient and you'll still achieve your goals, especially if you're willing to introduce something like exercise into the regime. That's even better. And if you're able to get enough rest and sleep. One of the problems is people don't get enough rest, and so they're fatigued and they don't want to exercise. They have trouble feeling good, so they're using food for all kinds of reasons other than nutritional needs. And so, of course, it's a catch-22. And also they're being told, oh, well, fat's good for you. Take a shot of olive oil. Red wine is good for you. It's got resveratrol. It's good for your whatever, antioxidants. So drink some wine. Oh, chocolate. Chocolate's wonderful. It's full of antioxidants. Have some dark chocolate. That's good for you. So now we've got a chocolate olive oil wine diet, and we're wondering why people are having trouble losing weight. It's like the vegetarians that say, well, Oreo cookies are vegetarian, potato chips are vegetarian, Coca-Cola is vegetarian. You can put a really awful diet together and still be vegetarian or still be, including superfoods. So I think that's where if people really want to think about this critically, they should read our books, The Pleasure Trap and Can Fasting Can Save Your Life. Can Fasting Save Your Life? Excuse me. Because you'll get a really critical analysis. One, the pleasure trap, you got Dr. Doug Lyle, who did a great job of really thinking through why people have so much trouble with this. And in the case of Can Fast and Save Your Life, Tasha Myers, who's our director of research, is really skilled because she can take complex issues, but describe them in simple terms that even somebody like myself can really understand. So I have to say, it's, I think, going to be a really valuable tool for people if they want to get their thinking straight.
What if we have someone listening who's thinking about giving it a go up at True North, but maybe has some concerns about losing the pleasure of eating when they come out of the fast if they're going to cut salt, oil, and sugar, right? People out there, they're like, oh, I'm a foodie, I couldn't do that, yeah. How do you help people? I mean, what is it?
Well, the hedonic response to food actually improves with fasting. It doesn't decrease. If you look at people's satisfaction, it's true. What they're eating is different food. But it's like saying somebody that's used to damaging their hearing by listening to really, really loud rock and roll wouldn't like music because you turn them on to classical music or jazz or something that's not quite so blaring. So it doesn't mean you can't enjoy eating, but it's not the same in the sense that, just like when you quit cocaine, it doesn't mean you can't enjoy life. But you're not going to have that really intense artificial dopamine stimulation that has intense pleasure. For example, if you look at the amount of dopamine that is squirted out by the brain when you have an orgasm during sex, and you compare it to how much you have when you smoke cocaine, there's 10 times more dopamine smoking cocaine than having an orgasm. You can imagine how reinforcing that cocaine is. It doesn't mean, though, you're not going to have pleasure in your life. You will. In fact, overall, the balance of pleasure, if you read The Pleasure Trap, you understand that artificial stimulation is compensated usually by a dip. Overall, I believe that people will enjoy eating as much or more on a whole plant food SOS-free diet than they ever did with the greasy, fatty, slimy, dead, decaying flesh processed food diet. But the short-term pleasure, intense stimulation of that drug-like effect, it's not the same.
Right. And they can get it elsewhere, like by having sex or things that are okay naturally for humans to do. I mean, it doesn't have to be the food is what I'm saying. Like, we don't have to sit down every single meal and have this dopamine-like effect happen.
Well, if you're an addict, you do, though, because you miss it. And so, that becomes the focus of life. And so even though you're killing yourself, people would, it's like they say, I'd rather die than quit smoking. And they do.
What kind of things do you treat?
Okay.
We heard high blood pressure and overweight, but
yeah.
do you
we treat
cancer?
The diseases of dietary excess. So the disease is caused by dietary excess. So obesity, cardiovascular disease. So high blood pressure is the most obvious. Type 2 diabetes, autoimmune diseases are all the diseases where your body attacks itself. Rheumatoid arthritis, ulcerative colitis, asthma, eczema, psoriasis, these conditions. And certain types of cancer like lymphoma, we've shown that fasting can be safe and effective at managing. So that makes up about 70 to 80% of our population. And the rest are people that are healthy, but trying to stay that way. They may have been a person who was really sick 20 years ago, but now every year we've been doing fasting with them, and now they're healthy and they only need to do a short fast. It's relatively not exciting. It's what I call boring fasting. And healthy people, not much happens. They just rest, they go through the thing. It's not a big deal. Whereas the entertaining people are the people that are coming off a lot of drugs and are eating really terrible diets because they go through these intense healing crises, which are kind of exciting.
And when you say fast, can you tell us a little bit about the lead up to a fast, and then also clarify how your feelings are about anything other than water during a fast?
So lead up is really important, actually. If you want to have a pleasant rather than intense and miserable experience, leading up to the fast is really important. Whole plant foods. In fact, we use fruit, salad, and steamed vegetables only for the 2 days before fasting. We encourage people to do that even before they get there. So we have an easy no coffee, alcohol, animal foods. Medications are a little tricky. You have to wean those very carefully. Some medications you don't want to just arbitrarily stop because it can be really very serious. Anticoagulant therapies, prednisone, et cetera. These are not things you just stop. You have to do that with a doctor that understands how to make that transition. Once a person is stabled off their meds, we'll fast however long it's needed, whether it's 2 days or 20 days or 40 days. And then they recover for half the length of the fast, where we gradually reintroduce the food. So for every week of fasting, you might have a week of vegetable juices and broth. There might be, for every week of fasting, there may be a day of raw fruit and vegetables. For every week of fasting, there may be a day of adding steamed vegetables, so that by the time you've had half the length of the fast, you're back to a whole plant food SOS-free diet. And we ask people to stick to that diet so they can sustain the long-term results.
You mentioned that if you fast and then go on a very healthy, whole food, plant-based diet without sugar, oil, or salt, you won't lose as much muscle. A lot of people.
You'll preserve your muscle and you'll regain your muscle by 6 weeks post-fasting. That percentage of the body that's made up of lean tissue is actually higher than baseline in our patients, but the fat loss continues. You won't stop losing fat if you're willing to eat well. Now, if you go back on the sugary processed crap, of course, you're going to be able to get fat again. And maybe even easier in the sense that now your digestive system's working, you're able to absorb what you're eating. This is not for people that are not serious about making diet and lifestyle changes. This is for people that either feel they have no choice because they're dying, their condition is limiting them, or they really want to stay healthy. It's not that you're going to live forever. You definitely won't. It's that you can avoid the debility that often accompanies the last 20 years of people's life. People live their life, they have strokes, they have heart attacks, they find themselves unable to talk or move, lying in nursing home beds, waiting for people to come and change their diaper. And what we're trying to do is delay that. You're still going to die, but we want you to have a good life and a good death where you go to bed and you don't wake up because you've reached your genetic potential, not because you have to have people caring for you and be debilitated for decades.
I'm curious about what a day in the life at True North might feel like to someone, right? Because I'm just imagining just all these zombies wandering around and you don't really have any energy to go do much. I was speaking to someone who was there for, I don't know how long he ended up going, but he was on like day 8. And we had a Zoom meeting in his room at True North. And he was like, my brain is not working at all right now. What? It's like, I get it. That seems like, what was he experiencing?
Right.
For
so his
him
brain
to say
was
that?
changing fuels at that point from burning glucose, which is normal for burning beta hydroxybutyric acid. So it's a completely different fuel. And that's why, during fasting, we recommend resting. And since your biggest burner of glucose is your brain, it's a good thing that the brain kind of shuts down. Otherwise, you'd end up burning a lot more glucose and breaking down a lot more protein. But people are not zombies. It's really interesting watching people that once they get into fasting, they're going to cooking classes, they're going to Tai Chi, they're going to learn meditation.
Cooking classes sounds terrible. I was just going to say.
Cooking classes, they're going to food preparation classes and enjoying it. They're not hungry. You go into ketosis. That's one of the hunger blunting mechanisms of fasting that they're trying to mimic with the high protein diets, is when you're on a high fat, high protein diet and no carbohydrates, you have no hunger. And that's what they're using it for short-term weight loss. The problem with these high protein, high fat diets is it's not a sustainable long-term health promoting diet. So down the road, they get problems from constipation to gallbladder problems to heart disease and cancer. So that's not what we would keep. And you wouldn't keep a person on fasting forever either, would you? So it's a short-term intervention. But during the fast, hunger is not a driving factor. You think, well, I haven't eaten for a week, I'm going to be all hungry. That's not what most people's experience is. They do slow down. We want them to slow down. But they're actually quite engaged. We have a courtyard. You see people even up 30 days into a fast, they're interacting with other people. For many people, it's really an epiphany experience. Fasting changes how you feel about yourself and the world around you. There's a reason why every major religion, the Jews, the Jains, the Hindus, the Christians, the Muslims, they all have traditions about fasting because it changes how you feel about yourself and the world around you. We're not coming from a spiritual viewpoint at True North Health. We're strictly a health care facility, but you can't deny. I mean, you see these profound experiences people have, and they make, a lot of times they make decisions to improve not just their diet, but their entire lifestyle. Sometimes they decide they don't want to drive 2 hours a day to a job they hate and work with people they despise for a company they detest, to make things they don't believe in, to make money they don't really need because they thought they were unhappy because of a deficiency of short-term pleasure-seeking, self-indulgent behavior. And they decide, I'm going to make some changes. And one of the most important components in improving your happiness potential is health. If you're healthy, it doesn't guarantee you're going to be happy, but it increases the opportunity for you to experience the overall balance of your life experience is highly positive.
You were the lead researcher on a study that was about fasting called medically supervised water-only fasting in the treatment of hypertension. Can you give us some more information about that?
Well, that was our first study, and the only reason that ever got done was because one of my heroes helped us with it, and his name was T. Colin Campbell from Cornell University. And Dr. Campbell at that time, well, what had happened was he was the first scientist to ever discover dioxin, the active agent in Agent Orange, and he got a massive exposure, and he developed some problems, including dystonia. And we met, and
What's
he decided
dystonia? Is that?
He lost the ability to speak properly, had some neurological symptoms. It was a mess.
Wow.
And they told him, well, dioxin poisoning, what are we going to do? So he decided, knowing what he knew about fasting and animal studies, he decided after I talked to him to come to the center and fast, and he did. And to make a long story short, he got well. And this was 30 years ago. Here he is, 90 years old now, still writing books, making huge impacts. But anyway, when he was at the center, he saw the work we were doing with high blood pressure. And he said, let me help you get that published. At that time, he had published, 250 papers in the scientific literature. He took our data back to Cornell, and he helped us get it processed, get the analysis done. And ultimately, we were able to get it published in a peer-reviewed journal. And so that was our first publication. The reason I had picked blood pressure was because my uncle, who was a physician, was very negative about this everything about the work I was doing in this type of medicine, and fasting, thought it was terrible. And he actually, when I was 16 years old, told me that I was not to go on a vegan diet, that wasn't healthy, and that I was not to go into alternative medicine, which is what I was saying I wanted to do. And he said that better I should be a communist spy. He thought that was the worst thing that somebody could ever do. And I remember my father took me aside. My father was a pretty serious guy. And he said, Alan, your uncle is a very prominent physician, and he doesn't like this alternative medicine stuff. And he said, anything that makes him that upset and angry, well, it can't be bad. So you stick to your guns, and good luck to you, son. So he encouraged me. And, but I decided I was going to show my uncle that, so we decided we would do a study on blood pressure. I called him when I was doing osteopathic training in Australia. I said, Uncle, these people with blood pressure are getting better. And he said, no, they're not. I said, they're getting better. I'm taking their blood pressure. He says, then you don't know how to take blood pressure. He said, I've been in practice for 50 years. They never get well. So I came back. We got the right equipment. We started to do standardized protocol to measure blood pressure. And sure enough, they were getting better. Dr. Campbell comes along. He helps us publish this paper. So my uncle wouldn't help. He wouldn't look at the data. He said he wouldn't waste his time looking at nonsense until it was published in a peer-reviewed journal. We finally get the paper accepted with Dr. Campbell's help. 2 months before it comes out, he has a massive heart attack, that is my uncle, and dies. And my mother swore he died just so we wouldn't have to admit he was wrong. I don't think that's true. I think he died from the kugel, the kreplach, the knishes, the blintzes, and all the other stuff that he ate. But we'll never know for sure, will we?
Well, maybe he's looking down on you now and going, yep, my nephew Alan was right.
Well, my wife says the entire operation is just to prove I'm right and everybody else is wrong. So, maybe that's true.
That's okay.
How did you get interested in fasting in the first place?
It was mostly Dr. Lyle, our clinical psychologist. I knew him since fourth grade. And he used to beat me terribly in basketball. He was much better. And I thought if I got healthy, I might get an edge. And I started reading some books, and I read Shelton. And Shelton said health was the result of healthful living. It was diet, sleep, exercise, and that fasting could help you. So I thought, well, I'll try this diet and see if it would help. And of course it didn't, because Doug adopted the same diet. And here we are, 65 years. This is, 50 years later, he still beats me every time we play. It's really terrible. So it was total failure, but it got me interested in all this. And so, when you talk to people on the spectrum, how some kids are interested in spiders and some are interested in dinosaurs. I happen to be interested in this. And so that's all I've done. I spent my entire life just looking at how to not feed people. It's like.
How wonderful that you and Dr. Lyle have been changing the world together for so many years.
Yeah, it's been very helpful. He was the lead author on our first paper, along with T. Colin Campbell. Otherwise, it never would have gotten done. So he's been helpful, and of course, his work on the pleasure trap was amazing. He's a really bright guy. So I feel very fortunate that we've had his influence. Even if I don't ever tell him I said this, though, because that psychology stuff he does, I always poo-pooed that. But it turns out it's actually really helpful.
Really helpful. We'll have him listen to this. There's so many nutrition beliefs and nutrition myths today. Is there one somewhat common nutrition myth that really frustrates you the most? And then what is the truth behind it?
Well, none of it frustrates me because I believe that stress is like Christmas and it's better to give than receive. And I try to be as generous as I can. And as far as the beliefs people have, I understand why they believe what they believe because it's what they want to hear. It's like John McDougall says, people love good news about their bad habits. And so in order to defend your addictions, you have to justify why you're eating salt, oil, and sugar. And to justify your addictions, you have to justify why you're eating chocolate or wine or whatever the heck it is that you're indulging in. And that's usually what drives most people's vehement arguments against a whole plant food SOS-free diet is they just don't like to have to face the fact that, a healthy diet involves whole plant foods rather than, more concentrated processed foods that they would prefer to have because of the pleasure trap. If you really understand the pleasure trap, you understand people are doing the best they can. They can't help it. They're just dealing with their own frustrations, limitations. So I try not to get angry at them. Dr. Lyle explained to me basically how cognitive therapy actually works. And he said, it helps people restructure, what they're seeing and their stresses. For example, if you're in an elevator and somebody starts poking you in the back with a sharp stick, you get angry and you turn around and you think like, what the heck? And you see it's a blind person and they're not trying to hurt you. They're just trying to figure out where they are in space. Your anger goes away. You still step out of the way because you don't like getting poked with a stick, but you're not going to be angry with them because you realize they're doing the best they can. They can't really help it. And so a lot of people you're dealing with that are doing really awful things, it's not they're trying to be awful. It's just they've got limitations, whether it's in their understanding or their experience or their own personal life, whatever. So you try to understand that they're doing the best they can. They're just not being as effective. And so maybe that helps not be so angry. Angry is kind of an expensive emotion. You really don't want to spend too much time angry. Not good for you.
Well, The Pleasure Trap is a wonderful book, and I recommend that. And Can Fasting Save Your Life also sounds like it's going to change a lot of people's health.
I hope so. We've spent 2 years working really hard at bringing together all the results of the original research that we did, which I think is kind of unique to the Can Fasting Save Your Life. Most books are not based on the author's own research. So we've brought that together, and Tasha Myers is really, truly brilliant, and she's translated it into a way that it's understandable, because some of this is pretty technical material. This book is written for the average person to understand faster, but it's also written for the average person's physician so that they could understand what's going on and how to guide a person through the process without screwing it up. So she's kind of walked on both sides of the aisle there, and making it understandable, but also providing enough technical information and enough research-based support to convince a person that's pretty critical in their thinking that in fact health really does result from healthful living, and that a part of healthful living includes diet, sleep, and exercise, and that fasting can be a useful tool to facilitate that implementation and change.
Yeah.
Well, thank you so much for being on the show, Dr. Goldhamer. It's
Thank
been
you.
wonderful.
I just wanted to mention to your viewers, if they're interested in finding out if fasting is relevant to them, they could read our book, which is great. And we also offer a free service. If they go to our website at truenorthhealth.com and they fill out the registration forms, I'll review their medical history, offer a no-cost phone conversation with them so that we can steer them in the right direction. Are they a candidate for fasting? Who either closer to them than us if they can't come to us, or maybe one of our telemedicine doctors can help them, move in the right direction. So it is something that they can do without any cost. And for many people, it seems to be of some help.
Wonderful. Well, thank you so much. I think you would definitely, True North has helped 25,000 people, and your book is probably going to help even more.
Hope so.
If that's
For sure.
all right.